Hi, my name is Dr. Chad Watkins, and I'm with Watkins Foot and Ankle Clinic in Leesburg, Florida. And today I wanted to talk about hammertoes. Essentially, a hammertoe is a contracture of the toe, and you can either have a hammertoe, a claw toe, or a mallet toe. They're just different areas where the contracture of the toes occur. Essentially, a hammertoe occurs because there's a tendon that comes along the top of the toe that attaches to the second bone, what we call the middle phalanx. And it will pull the toe up at what we call the proximal interphalangeal joint. There's a tendon on the bottom of the foot called the flexor tendon that goes to the tip of the toe and attaches to the bone, which is called the distal phalanx at the end of the toe, and it will pull the toe down. So what's happening is you have the toe pulling down at the tip of the toe, and then the tendon on the top pulling the toe up at the top, and so it'll cause a contracture. So a true hammer toe will flex at this joint, then you have a claw toe, and then you have a mallet toe where the toe bends at the tip. So what we do in surgery is we will go in and we will release and lengthen the tendon on the top of the toe. And then what we do is take out the head of the bone. And we do it in a stepwise fashion. So if that corrects it, we stop there and we make a fake joint and we put a pin in the toe. If that doesn't correct the situation, then basically what we do is we fuse the toes together. And so what we do is essentially take out the base of the middle phalanx and the head of the proximal phalanx, and we make them one bone, and then we put a pin across it or an internal screw or some sort of fixation device. So if it's a severe rigid contracture of the toe, we'll fuse the toe stiff so that it doesn't basically contract again. If it's semi-rigid and it can bend and move, then we'll stop at just removing the head of the bone, and we'll make a fake joint, or what we call an arthroplasty. So if we come over here, you can see on this patient, they have a curly pinky toe where it curls underneath. And so often what we'll do for that digital deformity is basically take out the head of the bone and then rotate the toe straight. If we had a mallet toe, which you can see it bending just a little bit here at the tip, we'll make an incision and basically just take out the tip portion of the bone, which allows the toe to straighten out at the tip, and then we'll put a pin down the toe to hold it straight and in position. If we have a classic hammer toe, okay, which once again, this is what a hammer toe would look like, and this is what a claw toe would look like. So it looks like a claw. For either a hammer toe or a claw toe, what we do is basically make an incision along the top of the toe and take out the head of the bone or the knuckle and make a fake joint, and that makes it stiff and straight. If it's continuing to be contracted after we remove the head of the bone, then that's when we make a decision on to fuse the toe. And so we take out the base of this bone and then we just make it one bone, and we put a pin down across the toe. So basically that is hammertoes or digital deformities. If you're having any problems with your toes, give us a call at 352-805-4317. Once again, we're Watkins Foot and Ankle Clinic located in Leesburg, Florida. Thank you very much. Bye.